My wife fell to the floor. I do not know what happened. Please send help.
Help is on the way there, sir. Please be patient.
Hi, Miss Rose. I'm here to take your vital signs. Can you explain what happened to me, sir?
She's been complaining of pain. She hasn't been herself lately. She's been very ill. And all of a sudden, she just fell to the floor.
Have you been experiencing any weakness or fatigue, weight loss, no appetite, chills, fever, sweating at night, maybe pain in the chest, Miss Rose?
Well, I think so. I feel weak, lost a lot of weight, and I've been sweating in an excessive amount. I felt almost as I had a virus.
That's interesting. Let me go check with the doctor and see if they have gotten your results back.
Laboratory results came in, and I'm sorry to tell you this, but it appears you came out positive on your tuberculosis test.
The doctor will be explaining further details on tuberculosis for you.
An infectious disease that can affect almost any tissue of the body, especially the lungs. It's caused by the organism Mycobacterium tuberculosis and characterized by tuberculosis.
What? No, this can't not be happening. What does this mean? Am I gonna die?
No, you will not die. However, we have to put you in isolation precautions.
Sir, if you would like to come with me, I would be more than happy to show you the room where your wife would be kept at. Let's head back to your wife's room and see if the doctor can explain further information to you and your wife about tuberculosis.
It is rare to find it, and since they have a vaccination now.
Your wife was experiencing a sign that was very common in finding tuberculosis.
A cough that is no longer than 3 weeks and chest pain.
It's not spread by shaking someone's hand, sharing food or drink, touching bed linens or soil seats, sharing toothbrushes, kissing, that sort of stuff. But it is spread through air. Someone brings in the bacteria and they get infected. It spreads more when the lungs and throat are infected.
Anti-tuberculosis drugs such as isoniazid, rifampin, ethambutol, and pyrazinamide.
There are two ways to get tested by tuberculosis. There's a skin testing and there's a blood testing. You go to a doctor to get tested, or you can also go to your local health department. There are two types of tuberculosis. There is latent tuberculosis, which is when the tuberculosis infection is spread to all over the body and is harder to find because there are no symptoms as a normal tuberculosis person would have. You are more susceptible to getting tuberculosis when you are surrounded by those who are infected by it, or if you have a low immune system, or also having HIV. This means that you can develop tuberculosis in the pleura, which is the covering of the lungs, in the bones, the urinary tract, and sexual organs, the intestines, and even the skin. We will leave you alone to process this, and if you have any more questions on tuberculosis, please be sure to ask.